Alright, in this video we're going to cover cancer because we are talking about the integumentary system. One common form of cancer is skin cancer. And so since we haven't talked about it yet, just a little bit of background on what cancer is. And so in our biology lesson, we actually talked about something called the cell cycle. And the cell cycle was all of the events that cells go through as they grow and divide. Well, cancer is a disease that's caused by cells that divide uncontrollably. So normal healthy cells are going to go through the cell cycle and they'll go from 1 into 2, and then normal cells will get a message to stop when they don't need any more. But unfortunately, cancer cells, due to DNA mutations or some kind of damage to the DNA, they don't get regulated properly. The cell cycle is highly regulated by many different factors. It's pretty complex. It's actually very complex, which is why cancer is not easy to fix or cure in many cases. And so what will happen is when the cell's DNA is no longer good, they can lose control of the cell cycle, and they just divide and keep dividing and keep dividing and keep dividing. Now, when that uncontrolled cell growth occurs, it can lead to a mass of cells called a tumor. And those tumors can sometimes not be too bad, but what will happen is as they grow and grow and grow, they're going to start to become harmful. And so some tumors, when you go to the doctor, they may tell you that they are benign, and in that moment it's a harmless tumor. It's not necessarily damaging tissues around or causing any kind of major issues. But what can happen is these benign tumors could eventually become what we call malignant tumors. And these are the ones that when we find a malignant tumor, we typically say that you've got cancer. So what will happen is the tumors will begin to invade tissues, and they'll begin to produce cells that are going to possibly break off and move somewhere else. And we call this spreading metastasis, or we say that it is metastasized. And so this is when we really get into cancer and malignant tumors. And so we look at cancers in terms of their ability to metastasize or spread to other areas. And so if you're talking about a tumor type of cancer, we can look at, a lot of times it'll be identified as different types of stages, like maybe stage 2 or stage 4. And it has to do with the size of the tumor as well as the spread of the tumor. And so sometimes you just have what are called precancerous cells. They're abnormal cells. They have potential to become a problem, but in that moment, they're not really considered cancer. Stage 1 is what we call early stage cancer, and that's where they're relatively small. They're only in one area. They're a lot easier to go in and remove. Once they start to invade nearby tissues, we call them either stage 1 or stage 2, depending on the level of invasiveness. And then stage 4 is when it's already spread, and so we call that metastatic cancer or advanced cancer. And these are going to be more difficult to treat because the cancer has spread to other areas of the body. Now, in terms of cancer, we classify them and identify them and name them based on the organs or tissues where they originated. There are many, like over 200 different types of cancer. So there's all different types of cells and tissues in our bodies and organs, and so there's many different types. 2 general types that we're going to look at are carcinomas and sarcomas. Carcinomas occur in epithelial tissue like the skin and the linings. Sarcomas start in connective tissue like blood or cartilage or bone. And so our skin, which is a combination of both epithelial tissue and connective tissue, our skin, because it's on the outside, it's constantly taking a beating. It's going to be exposed to all kinds of variables. The environment is constantly changing. There could be chemicals, there could be temperature changes, all kinds of issues that could abuse our skin. And so oftentimes that could lead to that DNA damage, which could then lead to cancer. So we're going to look at 3 main types of cancer in the skin. There are others, but they are not nearly as common, and they affect maybe very specialized types of cells. So we're just going to look at 3 common ones. The most common being basal cell carcinoma. Remember, carcinoma is going to be in the epithelial tissue, and this is going to specifically take place in the stratum basale or the stratum basal. Now what can happen is as that tumor grows, it can begin to invade the dermis and hypodermis. Typically we find these in areas that are exposed to the sun a lot, like your face and your neck. They are slow growing, and if they're caught early, they're usually pretty easy to surgically remove, but they could be more harmful if they're not caught in an early stage. The next type is a squamous cell carcinoma, and the name indicates, they're going to affect squamous cells, and so this is going to occur in those keratinocytes in the stratum spinosum, that spiny layer of the epidermis. And so these are the second most common types of cancers. They typically lead to lesions. You can find them on the scalp, ears, or hands, but really anywhere on the body. A lot of times they're kind of crusty looking and they may not seem to heal. It's almost like a bump that doesn't want to go away and heal. Now they can be more aggressive and they can metastasize if they aren't caught early and removed. But if they are treated early, pretty good prognosis. Usually surgery and maybe some radiation to take care of your squamous cell carcinomas. And then one of the worst types, or the worst type of skin cancer, is going to be a malignant melanoma. And as the name implies here, the melanoma is going to have to do with those melanocytes, which are going to give the skin their color. And so these melanocytes just divide uncontrollably. Normally it starts from a mole. Doesn't always, but typically you have a mole. And so a lot of times you're supposed to kind of watch your moles and look for certain signs that they're no longer a normal mole anymore. So a lot of times they'll begin to appear as an asymmetrical type of mole with maybe some patches or uneven borders. And these can be very fatal. And the reason why is because they're highly metastatic. And so a lot of times if we don't catch them early, they will have already spread. And once they spread, they're much more difficult to treat. So they can surgically remove them and maybe treat them with immunotherapy. But if they're not caught early, it could definitely be very harmful. And so some ways to check for malignant melanoma, we have a couple of rules that you can follow. You have the ABCDE rule, or the ugly duckling sign. Now, in terms of the ugly duckling sign, a lot of people have moles. I mean, they're not uncommon. They're just collections of those melanocytes. But what you're going to look for are moles that are unlike the surrounding ones. So if you have several moles on your body, it doesn't necessarily mean you have malignant melanoma, but what you can look for are ones that are different from the ones around them. Maybe they're bigger or darker, or maybe they're just isolated. So if you kind of have one that just stands out, it might be worth checking into. On the ABCDE rule, you're going to look for certain features of your moles. So normal moles are going to be symmetrical. They're going to be uniform in color. They're going to be relatively small. And so what can happen is when they are cancerous, they typically have an asymmetrical border. They're not going to have a perfectly round shape. The two sides are going to be different. The border is going to be irregular. It's going to kind of look more like a fried egg than a circle and kind of just be scattered all over. There's usually multiple colors, different shades of darkness, lighter areas, darker areas, kind of look speckled almost. The diameter is going to be large. Typically it's larger than a pencil eraser. Once you start getting bigger, it might be a concern. And then if it is changing over time, so if it's getting bigger over time or that color is changing over time, that's going to be a sign that it could be cancerous, and definitely want to get those checked out. So this is what you could look for in terms of asymmetry, uneven borders, different coloration. The size could grow, or you could just see a change over time. And then in terms of ugly duckling, once again, we're just looking for moles that kind of stand out. They're not like the surrounding ones. All right, so a type of cancer that forms from fat or cartilage, so that would be connective tissue. Carcinoma was an epithelial tissue. Sarcoma was going to be connective tissue. Lymphoma has to do with the lymph and the lymph fluid. And then carcinogens are actually substances that cause cancer, things like asbestos, chemicals, cigarette smoke, radiation, things like that. What type of skin cancer can come from a pre-existing mole? That was our malignant melanoma. They're the ones we want to watch our moles and make sure they're not changing. In our next video, we'll cover appendages of the skin.